Some funky video, didn't you think, with the sound effect and all?
I guess that was the bus driver.
Right? It could have been. We told you at the top of the hour that the president is about to take charge of health reform in a big way, set to spell out specifics he wants in the bill, ready to tell Democrats what he will accept and what he will not, and analysts suggest perhaps leaving Republicans behind the voting process. If that's the case, what do Republicans say? California Republican Congressman Darrell Issa is with me out of California. Good morning, sir, to you. I think there's three things that we really need to focus on, and there's this. Based on reports, the president will accept the fact that there's no public option in the new health care reform bill. That may be like music to the ears of Republicans. I think you'll get an earful on the Democratic side of that. But if the public option is out, does it have enough votes in the House?
Well, all of the votes so far for this bill are on the Democratic side. One of the challenges we face is we've been locked out of the process from day one. The argument over public option, no public option is between the blue dogs and the progressives. What we'd like to see is about 1,000 of the 1,100 pages taken out of this bill and a few pages put in that specifically deal with the things that are driving up the cost of health care. But we would like to join with the Democrats in making it affordable and available and transportable, which is really what the American people have been asking us for throughout August. It seems as if
there's a lot of common ground on some of the things you just mentioned there, but you say you want to put some things in the bill to do what, specifically?
Well, I mean, one of the challenges is this bill does not deal with interstate operability. It doesn't deal with allowing for larger pools to be automatic so that the small employer and the individual and the person whose COBRA has run out would be able to join a large pool and not have pre-existing conditions or any of the other challenges that they often face in renewal with them. So that's a simple one. It has no tort reform. It has nothing close to what we have in California, MICRA, something limiting these sometimes out of control, punitive, so-called pain and suffering claims that drive up the cost of health care. No one on the Republican side wants to deny people the ability to be compensated if they're injured, but we want to limit that compensation to what they've had because that allows doctors to do their job with less fear. Less fear means less defensive medicine, drives down the cost of medicine. All of these things are actually agreed to, but not in the bill.
Right. Everything you're saying goes to cost, doesn't it? Because of that CBO estimate that came out a month ago that said it's going to cost us $1 trillion. It seems like everything you're mentioning would reduce that cost. Do I hear that correctly?
Oh, absolutely. And Bill, you might remember that before they started vilifying insurance companies and vilifying different groups, the original point that we started with was Canada costs 9% of GDP. We cost 18% of GDP. This bill takes us to 21% of GDP. What we'd like to do is find ways to get our cost of health care, but our health care, the kind that we like, closer to the Canadian model in price, but still give the kind of choice that Americans have. That should be the common ground for Americans.
Well, so then you would get Republicans to go for that. You might get some Democrats to go for it. You probably get the blue dogs to go for it, but then you leave out the far left of the Democratic Party. I mean, when you put that mixture together, does that have enough votes, for crying out loud?
Well, if the president wants to look to the progressives who want a single-payer, nationalized health care and say, you're not going to get it, you're really not going to get it, then we have common ground to do something where Americans maintain their choice, but we work together to drive down the cost and up the availability for Americans. You know, I have a simple bill. It's only one page that simply says every American can have the same health care that members of Congress have, without pre-existing conditions, without any problem in changing plans. It's one page to give Americans a choice of over 300 different private plans that are all affordable.
That is the one question we get from viewers, overwhelmingly more than any other email question about health care. If members of Congress can have one plan, why can't the rest of the country? How's that been received?
Well, it's been received well, and the other half of it, oddly enough, is Americans can't understand why we're exempting about 3 different groups in this 1,100 pages. One of them is the federal worker. The federal worker who has a good program, one that I'm in, is actually exempted. So is the Veterans Administration for a period of time, et cetera. What they've done is they've carved up temporary year out in order to keep groups from going ballistic, including the federal workers, the veterans, the retirees. That's not a right way to do legislation. The right way to do legislation is not to do 1,100 pages and leave a lot of what-ifs for later.
Wow.
Let's do well what we can agree to do and see what happens.
Yeah, with regard to the what if, we're going to talk to Stu Varney in a matter of minutes about preventive medicine and how much money it truly saves you. And there's large debate about how much money in the end you can save. Darrell, Issa, thank you for your time. We're waiting for you to get back to Washington. Both Republicans and Democrats to have it out. You got it. Thanks. Live in California. Megan?
They want to know about